Girls with ADHD often get missed.
Fact.
Bad parenting can cause ADHD.
Myth.
Adults can have ADHD.
Fact.
All ADHD kids are hyperactive.
Myth.
What is ADHD and what are the symptoms?
The first component is hyperactivity. They can't sit in one place, they want to touch everything.
What's the difference between ADHD and ADD?
If it's attention deficit disorder, so it's just the attention part.
Okay.
If it's attention hyperactive deficit disorder, then you have the whole thing.
Is this something that's lifelong? Because we see a lot of adults.
It's there. Many of us also have.
Oh, really?
We all have them around 10%. 1 out of 10 kids
A large
has
number.
it. Exactly.
Yeah. Let's talk about the diagnosis.
There's no MRI, there's no CT, there's no X-ray, there's nothing which you do as a scan which is diagnostic of ADHD.
What is the treatment?
So ADHD is not something that leaves you, it's with you for life.
Hello everybody, this is Namita Thapar, Executive Director of MQ Pharmaceuticals, and today we're going to be talking about ADHD, Attention Deficit Hyperactive Disorder. 10% kids have this condition. I use the word condition very responsibly because last time when I spoke about autism spectrum disorder, a lot of the community, rightfully so, told me, why are we calling it a disorder? Let's call it a condition. But till we have the medical terminology of ADHD, I beg your pardon, we'll refer to it as ADHD, and we have a wonderful expert on mental health, Dr. Anaita, with us today. Dr. Anaita, thank you so much yet again for joining us and for educating us on this very important topic. So, Doc, let's start with the basics. What is ADHD and what are the symptoms?
So ADHD, as you mentioned, attention deficit hyperactive disorder, is a conglomerate of 3 basic symptoms. As you said, the incidence is 10%. It varies from 7 to 10% from country to country, but on an average, it's similar worldwide.
Right.
The first component is hyperactivity, seen more commonly in boys in the ratio of about 2.5:1, boys is to girl ratio, and seen mainly in the first decade of life. So what is the hyperactivity? Basically, it's like they have roller skates on their feet. Okay, they can't sit in one place, they want to touch everything, they're very fidgety, the pencil falls, they pick it up immediately, they're just all over the place sometimes. They want to be first in the line. They can't wait their turn. If they put their hand up and 3 people put it, he can't wait for the other 2 to finish. He wants to answer first. Little things like that. Right. As you grow older, this hyperactive component, honestly, unfortunately, labels a child as the naughty boy. Okay? They get labeled as this naughty boy because he just can't contain himself as it is. The next feature is impulsivity.
Okay.
That's the inability to contain yourself or to think of the repercussions before you do something. Okay, so whether it's grabbing something which you want, the time it takes to ask, please, can I have it? The person might say, no, I'm not giving it to you. And this argument will go, I don't have the time for that. I just want it, so I take it. Forgetting who I'm talking to. I'm talking to the principal. I'm talking to my grandfather. I'm talking to someone where I have to put a respectful term instead of that, or I cannot just blast out at them, whatever I'm feeling.
Right.
So the inability to draw that line between where is correct and where you have crossed over to taking a liberty which is not there, that is where it comes into impulsivity. Right. This impulsivity, as you grow older in life, tends to get you into trouble. Okay? Because you do something where you might hurt someone. Right. You say something where it might cost you your job. You interact with someone and you say what's in your heart, but these things can't be verbally expressed on the outside, be it of any sort. But then once the words are out, you can't take it back.
Right.
Sometimes this impulsivity, if it goes further, they tend to be a little defiant in behavior. They tend to be a little oppositional in conduct. They tend to like to play with fire and little things which tend to get you into trouble more easily.
Right.
We forget sometimes the lines of hurt and not hurt, where I'm going to hurt myself and not.
Right.
So we'll jump off the sofa, we'll cry for 2 seconds, and you feel the pain, and 2 minutes later, you do the same thing again. You get it? Because you just can't contain yourself for those few seconds before you think, I told my mom I won't do it. I promised her I won't do it next time. But no, it happened before you could say so. And you say sorry immediately.
Right.
Because you mean the sorry. You get what I'm saying? But it just happens so fast that I'm unable to contain myself.
Got it.
And the last part is the inattention part or the concentration part, which I put down as hyperactivity of the mind. Whereas this is hyperactivity of body, this is more of the mind.
Correct.
It's usually picked up more in the second decade onwards. It's seen almost equally in girls and boys, 1.5:1, and very often missed. Now, see, if a boy is hyperactive in his childhood, you are looking for these features of concentration, inattention. You've guided the parents accordingly. You've told them, listen, it's going to affect his studies. He won't concentrate so much. Please keep an eye. We start working on tools and methods with behavior therapy as to how to improve that concentration. But if it's a young girl who hasn't had the experience of hyperactivity, very often it gets missed.
That's a very important point. That, very often in girls, it gets missed. So I think we should double click on this point.
Absolutely.
And it'll just make us more vigilant, right?
Yeah, absolutely. So when girls, whereas boys tend to externalize their concerns, girls tend to internalize their issues.
Correct.
You get what I'm saying? So they tend to, as you heard, they tend to mask everything. They tend to tide it over so that the outside world can't see what they're struggling with.
Right.
So girls, not only it's inattention, at that stage when inattention kicks in, it translates into drop in your grades. Because you see, when you're young, your study is so little that your intelligence compensates for the inattention.
Right.
But as you grow older and the portion becomes bigger and the answers have to be more connected, and you've missed what the teacher said for 3 minutes in between because you were looking out the window and seeing who was playing in the quad outside, you can't go home and put the pieces together because there's a limit to how much your intelligence can compensate.
Yeah.
And then your grades start falling. So then you begin to feel you're not good enough in studies, your grades start falling. Girls in that particular, some of them have depression, they have anxiety, some forms of self-harm, bulimia, any of those, anorexia. These are manifestations sometimes of young girls who might be having ADHD and are not picked up, identified, etc.
No, this is so important because, I think we time and again, and especially in the Indian context, hear about missing it in girls because they don't manifest it physically the way boys do. So I'm so glad you touched upon this girl versus boy issue. Doc, what's the difference between ADHD and ADD? Are they the same?
So basically, you don't have to have all three of the criteria. Okay. So you have hyperactive impulsive tends to go together, and you can just have inattention. So if it's attention deficit disorder, so it's just the attention part. Okay. If it's attention hyperactive deficit disorder, then you have the whole thing, which is
those three, which is hyperactivity, impulsiveness, and inattention.
Absolutely.
So it's basically depending on the number of symptoms that you demonstrate.
Right. So everyone doesn't need to have all.
Understood. Next question is about...
And the next important thing, very important thing I need to highlight is that these symptoms need to be present in all scenarios. It should be seen in school, it should be seen at home, it should be seen with family, it should be seen with friends before you can diagnose the patient having ADD.
What is the relevance of this point?
Because very often they misbehave at home, but they're angels in school.
Oh, okay.
You get it? So when you have a real condition where hyperactivity or this comes into the picture, it should be everywhere. So when you scale them or you do testing, one of the things you do is you give out scoring sheets to parents and to the teacher.
Right.
Why? Because the teacher and the parent should be on the same page. When you check their scores, there should be roughly a similar trend that the child is expressing everywhere. So if you see a teacher who says, no, this kid is perfect, he just does everything, he answers, he sits in class, and the parent says he's uncontrollable, he's playing up at home and this is only a home-related situation.
Understood.
You get what I'm saying? So it has to be something where it's seen in all spaces before you can put the label on it.
These are very important little nuances to pick up on. You spoke about tests. So now let's talk about the diagnosis. Is it a questionnaire that they fill in, or does it involve any brain scan as well to really diagnose a definitive ADHD condition?
No, so firstly, there's no scans that you do there's no MRI, there's no CT, there's no X-ray, there's nothing which you do as a scan which is diagnostic of ADHD. The single most important diagnostic tool is your clinical perspective, what you see and what you've picked up. Right. It's not just a one-day assessment, it's obviously something over a period of time, but there are tools that we use, there are scaling systems that we use, and as I said, we'll do it with the teacher, we'll do it with the parent, and the psychologist will be watching the child while they're doing the assessment themselves. So you've got three parameters which are roughly saying the same thing, that's when the diagnosis. So they have the criteria, they tick box what it is, and then they tell you which component is more, which component is less, which one is borderline, which one is out of the box, which one is very mild. And then the clinician actually decides what to do with the child from treatment point of view after they see those scoring systems.
Is it a standardized test, Doc?
It's a standardized
That's
test.
important because you don't want to leave it to
Standardized
judgment of people.
All tests are standardized, and we have them with international criteria, and we have Indian criteria as well.
And are they different, the international and
No,
Indian?
so they're roughly the same, but the terminology we use in these tests have to be related to the local language, the local customs, the local issues that we face, so that a parent can answer the question with the same understanding.
That's beautiful. So it's customized to the Indian temperament.
That's right.
Now, coming to the next question, which is very important, is this something that's lifelong? Because we see a lot of adults who come and say, I've been diagnosed with ADHD. So, just touch upon that a little bit.
So ADHD is not something that leaves you. It's with you for life. Okay? But as it manifests in the first decade with a lot of physical aspect,
Right.
it goes into the second decade where the concentration is a problem. As you move in life, you learn to adjust and manage yourself so that it doesn't interfere in everyday life.
Right.
You get it? So maturity comes in, understanding comes in. Your basic intellect starts teaching you that, listen, I can't afford to goof this exam, or I can't afford to goof this interview.
Right.
So you see that you find those tools or those behavior patterns which help you to calm yourself, stay in one place and do the job at hand.
Yeah.
Okay, so yes, it is there in adults. It's most likely been there all along. It hasn't interfered in him because if he's super smart or sharp, he's managed to compensate. And grades is unfortunately the way we monitor children today.
Yeah.
You get it? It's not on the character or the grades. And think back and think in your class. There must have been so many kids that you had where you said he was the naughty boy, or he was the impulsive boy, or he's the one who got in trouble with the principal or the teacher or the whatever. And today he's the CEO of a company.
Right.
You get it? And you never thought that this kid would reach there.
Right.
You get what I'm saying?
Right.
So we all have them in our classes. We all have them around 10%. 1 out of 10 kids
It's a large
has
number.
it.
Yeah,
Exactly. And
yeah.
it's just a different form of behavior. And I think life would be so boring if we didn't have people with so much variation and variability in our behavior. So I think it's there.
Yeah.
And many of us also have it within us as well. But if it starts interfering in your life,
That's the
if
important
it starts, you start losing jobs because of it. It interferes in relationships, sustaining jobs, staying in the same place, ending up with less friends because you did something which you regret today, but it's
The
killed whatever
impulsive
was
part.
there. So those little things start interfering in your life. And that's when many adults will come back and say, Doc, is there something, go to the psychiatrist or the neurologist, say, is there something you can do to help me with this?
Absolutely.
And very often I pick up parents when I've picked up the child.
Oh, really?
Yeah, so the other day I had a kid
The
who
parents
was
may be
like,
clueless that they have it.
I had a kid who was like all over the place. I mean, throwing, flinging, everything around. And dad says, I think I also have this, but nobody ever told me, but I can see a lot of similarities between what he's doing and what I did as a child. And you can see it in the conversation. The minute mom talks, we interrupt. The minute you say something, we want to put in our little piece of it. We can't wait for the conversation to get over. We can't wait for our turn to happen.
Correct.
Little things like that, which come into it, and you realize it is. And relationships have a problem.
Absolutely.
With parents, with partners, with siblings. Then it starts interfering in everything.
No, I think you said it beautifully, that all of us to some extent have this inattention and impulsiveness and all of that. But the point at which you really start worrying is when, like you said, whether it's a job, your family, other things in life, your relationships, where it becomes a real bond. And that brings me to my next question, that if you really reach that, that space where you're saying this is really, really disrupting my life, what is the treatment? I mean, is there behavioral therapy? Are there medications? How do you help them think through the treatment part?
So this is a very moot point, or a very, I wouldn't say it's debatable. Science is there to prove it very well. So you have behavior therapy,
Yes.
which can be, I always say behavior therapy is more for the parents than it is for the child.
Yeah,
because the parent has to learn how to handle the child to get the best out of the child.
Yes.
And a little bit for the child as well. So we teach them little things, put Post-its on your mirror, put the cap back, put the towel back, see that you put your toothbrush back, make your bed, pack your bag, see that your diary is in, little things. The parents have to learn how to use positive energy and positive behavior to get the best out of the kid.
Right.
So what we recommend is something like ignore bad behaviors, okay, and reinforce good behaviors with a reward. Okay, so you went the whole day and you did your homework, you wrote everything, there are no red marks, you wrote your date, you did your corrections, you did everything. Wow, I'm really happy with you. Come, let's do something together today. It doesn't have to be a bribe as in the form of a chocolate, a sweet, a car, or a gift. It can be just something the child loves. And invariably, when the kid is small, he loves nothing more than to have time with his parents.
Correct.
So it could be just a hug or a kiss. It could be going for a ride with his dad on the bike, one chakkar around the complex. It can be something small, but the concept is you were good, you got something for it. You were good, you got something. And you repeat it till the child realizes, if I do this, dad will take me for a ride, so I'll do it on my own. And I don't have to be told.
Correct.
And likewise, bad behavior, we ignore. We make it as little as possible unless it's too much. So the kid doesn't get a connotation between bad got attention from my parents.
Right.
You get it? So that's a behavior therapy. There are lots of other things that we can do to help them. But the other thing is medication.
Right.
So there are ample studies to show behavior therapy alone, medication alone, and behavior and medication. And without a doubt, behavior and medication comes hands down first.
Right.
Medication is also very effective, even alone. Right. And behavior therapy alone is good, but it needs support if needed.
Absolutely.
So my way of looking at it is behavior therapy is for life.
Right.
You get what I'm saying? If I teach you a way to handle yourself in a situation, you will translate this methodology when it's at an interview, when it's with your girlfriend, when it's with your whatever that happens coming down the line, with your own kids, etc.
Right.
Medication is for something which is now. And why does it help? Because it helps you recircuit your brains. So if I'm the good boy and I get pats on my back because I wasn't naughty, I sat in my place, I did well in my exam, and my teacher said, wow, look at you. I mean, you have so much potential. It's so good. And the kid feels so good with himself that he builds a circuit inside which translates and he wants to redo it again and again. Everyone wants to be loved. Everyone wants to be liked. No child with ADHD likes to be told, naughty boy, bad boy. How many times do I have to tell you? Why can't you do it? No one wants it.
True.
And what happens is when they try so hard and it doesn't happen, they tend to get a little blasé and a little defiant.
Yeah.
Why? Because even if I try, it's not going to happen. So let's act as if I don't care. You get what I'm saying? So you think they're a little blasé, you think they don't care, you think they're being defiant, but inside they all want to be the good boy. They all want to have teachers' acknowledgement, mom to say that what a good boy you were today. But we sometimes, if we can't get it, we act as if it doesn't matter.
Got it.
You get what I'm saying? So that's where behavior, and that's when I say a little bit of medication at the right stage puts the best face forward. Why would you want to put your child's worst face forward when he has the potential to be such a lovely, caring, happy, smart, sharp, intelligent child?
But then based on what you just said right now, would that medication that you would give be short-term or lifelong?
No,
How do we
so
go about
nothing-
thinking about it for ADHD?
Nothing is lifelong when we start. Yes, there is a small percentage who may need it lifelong.
Okay.
That's a different thing. By the time you're an adult, you have the ability to choose for yourself and decide, do I need it? Do I not need it? When do I need it? I don't need it every day. I need it only in certain times when I need to perform at my best potential and not look everywhere else when the interviewer is talking to me.
Understood.
You'll get little things. But otherwise, we tend to tell you, do it for a year, take it off in the summer holidays, go back to school in the beginning and see, is the teacher still complaining? Means you need it a little longer.
Got it. So it's like you have to figure out what works for you.
Absolutely. And behavior is something which changes not in 2 days, 10 days, and 2 months. It takes years sometimes.
Of course.
But once that behavior is set and your circuits are rerouted and you are so confident that you can do it on your own, you take off the meds and the kid manages fine.
Well, that's a great point. And along with meds, people also talk about diet, right? They say don't give too much sugar, vegan, gluten-free, omega-3. I mean, there are supplements. There's this whole gamut of, I always call it Google misinformation.
Yeah.
So can you educate us on
Dr.
diet
Google.
and supplements that Dr. Google is telling us about?
So there is, without a doubt, a gut-brain connection.
Yeah.
Okay, we do know that what we eat translates into who we are at the end of the day. And our gut is our basic, supposed to be our immune system. While scientifically there is no proof of gluten, casein-free diet, okay, so I do not recommend that. Scientifically, any of the supplements also are not found to be that beneficial, though it is the norm to give it to everyone today. Yes, sugars I don't think it's got to do with ADHD, it's got to do with all of us. If you have a
Absolutely.
high rush of chocolate at night, or you eat a whole bar of chocolate, you're going to find it difficult to sleep.
Yeah.
You get it? It's not got to do. And if a person is already hyperactive and got, attention related problems, calming that mind, calming that body, putting him into bed, and you've just given him a sugar rush, it's going to be tough.
Absolutely.
So we say avoid ODing, overdosing on too much sugars.
Right.
Natural sugars not a problem. Artificial sugars keep to a minimum, but this goes for everybody. It's
I
not
agree.
just, and preferably not in the night times.
I agree. That is a very important
Other than that, there is little evidence that some children particularly do not react well to certain foods. So if a parent finds that this food causes him to be super hyper, then you need to do a little assessment and see, and try and eliminate it and see. But very few of them have diet as a primary cause of, or a very prominent cause of their ADHD.
Understood. Now, comorbidities. We always talk about this in all the conditions we've touched upon, because we've realized that with every mental health condition, there is bound to be a few comorbidities. So let's touch upon that.
So children with ADD may have a slightly higher chance of epilepsy, a little bit of autistic features may be there, learning disabilities is little higher, oppositional defiant behavior is there, conduct disorders may be there, and tics. I would say these would be the main concerns or the comorbidities that come
That
with
we
them.
should look out.
None of them are strongly associated.
Right.
All of them have a small percentage in each of them. But if you have a child who has significant ADD, you would like to look for the other comorbidities and help them accordingly.
And this is important because as a parent, you should be vigilant for these other areas
Absolutely.
that you should also get an assessment and timely diagnosis for.
Absolutely.
I'm glad we touched upon that. Now, my last question, Doc, which is the most important thing is, when you look at ADHD and the ability to integrate in a school, in a job, just let's touch upon that in terms of how do we best equip them to adapt to the right school and the right jobs.
So firstly, they have to be in normal schools.
Yeah.
Secondly, they have to live normal lives and they have to get jobs and do everything that anybody else would do. Okay, this should never be a criteria to stop a person or not consider a person for a job profile.
Right.
The most important thing would be to educate the person on the other side to understand that this is not a disorder or this is not a disease of any sort. It's just a little imbalance of chemicals in the brain. Just like you've got happy chemicals and depressing chemicals and the imbalance tips you, you have active chemicals and laid back chemicals and the imbalance tips you.
Yeah.
You get it? So we just got to learn how to handle it.
Yeah.
So educating and highlighting and creating awareness to teachers, maybe doing a little inclusion, maybe a shadow teacher sometimes, giving the child that little extra time to do 2 chakkars in the class if he needs to, run in the playground a little more between a class, let him get up and go to the loo a little more often if he needs to. Yeah. Little things just to give him that space to get that energy out of his system. I strongly believe in exercise because it's a
Very
lovely
important.
way to dissipate extra energy. It improves your concentration. It improves the endorphins in your system. It gives you a happy feeling so that you're in control of yourself. Discipline is a very important thing for people with ADHD. They need to have regular schedules so that they stick to it, so that they don't procrastinate. One of the biggest problems they have is procrastination.
Right.
Okay, Peter's principle, they'll wait till the last day to fill their presentation, submit their form, whatever it is. So exam times, when you have schedules and you have to see that you submit your papers in time, very difficult keeping time for them.
Right.
So little things to help them with that, they can manage everything.
And this is exactly like you said, if you discipline your mind and if you put that consistency, then you won't procrastinate.
Absolutely.
So these are small tips where the kid can learn, and most importantly, the people around them can support them better. Doc, any other things we might have missed or any parting words on this? We're talking about 10% cases. That's a very high statistic.
No,
so I think we've covered a lot, but anything you'd like to leave us with?
No, I just think that they are as loving and as good and as intelligent invariably as your other children.
Yeah.
Or what you would, your other kids or other children in the class. A little understanding and a little knowledge of how to handle the situation can go a long way in making them believe in themselves. The most important thing I always say is a confident, happy child.
Absolutely.
That's all you want. And if you can do that little bit to make him believe in himself, trust me, he will find ways to do it himself going forward. But that little bit of confidence which comes in the very impressionable years when you're young, and I always tell them how you look at yourself, your school years. You sit back and close your eyes and look at yourself, and it has impacted you so much.
Of course.
So if you're labeled the naughty one, the mischievous one, the bad one, the difficult one, somewhere it sticks with you.
Yeah.
You get it? So you don't want that. So we want that every child should get an opportunity to showcase his best face and be a happy, confident kid. That's it.
That's so beautifully said, And that brings us to the end of this episode on ADHD. And I love the way doctor said that, these two words really stuck with me. It's not a disorder, it's an imbalance. And this imbalance can be beautifully corrected with the right ways of coping, CBT, behavioral therapy, and if needed, medication when it helps you. There is a solution, but what is important is to get educated, understand the symptoms, get diagnosed early. But one thing that you all can take away from this is the world needs to be kinder. Like Doc said, when you give them that confidence early on, they can blossom and they can really, really be these beautiful flowers that spread their fragrance all over. But for that, they need kindness, they need empathy, they need support. So let us all commit today to be a lot kinder and a lot more supportive and build an inclusive society. Thank you very much.